If you have sciatica pain, take this one tablet every single day, not a painkiller, not a prescription, a natural compound that has been sitting in health food stores and on Amazon for years, that most seniors with sciatica have never tried because nobody ever told them what it does specifically to the damaged cells inside the sciatic nerve. While every other supplement you take works on the outside of the nerve, reducing inflammation around it, releasing the muscles, compressing it, this one tablet works from the inside, penetrating directly into the nerve cells themselves, neutralizing the oxidative damage that months of chronic sciatica has been causing at the cellular level, repairing what nothing else reaches. Tonight I am telling you exactly what this tablet is, exactly how it repairs your sciatic nerve from the inside out, and exactly how to take it correctly starting tomorrow morning. And real quick, right now, drop a comment below and tell me 3 things: your age, your city, and how many months you have been dealing with sciatica. I read every single comment personally. Age, city, how long? Drop it now. And if you are not subscribed yet, hit that subscribe button immediately. Every week this channel brings you information this important. Now let us get completely into this. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. And tonight I want to address something that most sciatica protocols, even the best ones, completely miss. The damage happening inside the sciatic nerve cells themselves, not the inflammation around the nerve, not the compression on the nerve from outside. The cellular damage occurring within the nerve tissue, at the level of the mitochondria inside each nerve cell, that accumulates silently with every month of chronic sciatica and makes the condition progressively more resistant to every treatment being applied from the outside. Before I tell you what the tablet is, a story. Details changed to protect privacy. A senior in their early 70s came to me after 18 months of sciatica management. Their protocol was genuinely comprehensive: magnesium before bed, anti-inflammatory diet, daily stretching, consistent walking, topical magnesium oil, everything this channel covers, they were doing all of it. Their pain had come down from its worst, but it had plateaued at a stubborn 3 to 4 that refused to move lower regardless of what they added from the outside. During our consultation, I asked them one specific question. Are you taking anything specifically for the nerve cell oxidative damage, the cellular level repair that happens inside the nerve itself rather than around it? They looked at me the way most patients look when I ask this question, completely blank. Nobody had ever mentioned this to them. Nobody had ever explained that chronic sciatica produces damage inside the nerve cells, not just around them, and that this internal damage requires a specific type of intervention that most external protocols never address. I introduced one tablet, alpha lipoic acid, 600 milligrams daily with their largest meal. Nothing else changed in their protocol. 6 weeks later, their pain score was 2. The first time below 3 in 18 months, the internal cellular repair that had been missing from their otherwise comprehensive protocol had finally begun. Stay with me, because the reason this tablet works is something every senior with sciatica needs to understand. Here is what is happening inside your sciatic nerve right now that most people never know about. Every cell in your body, including every cell in your sciatic nerve, produces energy through tiny structures called mitochondria. Mitochondria are the power generators of the cell. They take oxygen and nutrients from the bloodstream and convert them into ATP, the energy currency the cell uses for everything it does, including nerve signal transmission, including nerve fiber repair, including myelin maintenance. When the sciatic nerve is chronically inflamed, as it is in chronic sciatica, the inflammatory environment surrounding the nerve floods the nerve cells with reactive oxygen species. These are unstable molecules that attack cell structures, including the mitochondria. Damaged mitochondria produce less energy. Less energy means the nerve cell cannot maintain its normal functions efficiently. It cannot repair its myelin properly. It cannot regulate its pain signaling normally. It becomes progressively more sensitive, firing pain signals more easily and more intensely with every month of continued mitochondrial damage. This is why chronic sciatica becomes more treatment-resistant over time, not just because the compression and inflammation continue, but because the nerve cells themselves are progressively losing their functional capacity due to mitochondrial oxidative damage. And every treatment that works on the outside of the nerve stretching, topicals, dietary changes, cannot reach this internal cellular damage. They reduce the pressure, they reduce the inflammation, but they do not repair the mitochondria. Now here's where alpha-lipoic acid becomes extraordinary. Stay with me. Alpha-lipoic acid is a naturally occurring compound produced in small amounts by every cell in the body. It is one of the few antioxidants that is both fat-soluble and water-soluble, which means it can penetrate both the water-based interior of cells and the fat-based cell membranes that most antioxidants cannot cross. This unique dual solubility allows alpha-lipoic acid to reach the mitochondria directly, something that vitamin C, vitamin E, and most other antioxidants cannot efficiently achieve. Once inside the mitochondria, alpha-lipoic acid neutralizes the reactive oxygen species that have been damaging the mitochondrial machinery. It reactivates damaged antioxidant enzymes. It supports the regeneration of other antioxidants, including vitamin C and vitamin E, that the chronic inflammation has depleted. And it directly improves mitochondrial energy production by supporting the enzymatic complexes that generate ATP. For the sciatic nerve, this means something very specific. The nerve cells that have been progressively losing their functional capacity due to mitochondrial damage begin recovering that capacity. Myelin maintenance improves as the Schwann cells get better energy supply. Pain signal regulation improves as the nerve cells regain the cellular energy needed to maintain their normal firing thresholds. And the progressive treatment resistance that has been building with every month of unaddressed mitochondrial damage begins reversing. Research published in the European Journal of Neurology found that alpha-lipoic acid supplementation at 600 milligrams daily produced significant improvements in nerve conduction velocity and pain scores in adults with peripheral nerve damage, with the improvements directly correlated with improvements in oxidative stress markers in the nerve tissue. The nerve was measurably recovering its functional capacity as the mitochondrial damage was addressed. Research published in the journal Diabetes Care, which has studied alpha-lipoic acid extensively for diabetic nerve damage, found that 600 milligrams daily produced significant reductions in burning, shooting, and lancinating pain in peripheral nerves, the exact pain qualities most commonly reported by seniors with chronic sciatica. The mechanism confirmed was mitochondrial antioxidant protection and restoration of nerve cell energy production. Now here is something very important that most people never consider about alpha-lipoic acid supplementation. The timing matters enormously, and getting the timing wrong significantly reduces how much benefit you receive. Alpha-lipoic acid should be taken with your largest meal of the day, typically dinner. Not on an empty stomach, not with coffee alone in the morning, with a substantial meal containing healthy fats. The reason is specific. Alpha-lipoic acid is absorbed through the intestinal wall via the same transporter proteins used by certain amino acids. When taken on an empty stomach, it competes poorly for these transporters, and a significant proportion of the dose passes through unabsorbed. Taken with a fat-containing meal, the absorption is significantly enhanced, and the fat-soluble component of alpha-lipoic acid's dual solubility is utilized most effectively when dietary fat is present in the digestive system simultaneously. The correct dose for sciatic nerve cellular repair is 600 milligrams daily. This is the dose used in the research confirming nerve repair benefits, and it is the dose that produces the therapeutic tissue concentrations needed to meaningfully address mitochondrial oxidative damage in peripheral nerve cells. Lower doses, the 100 to 200 milligram doses found in many general antioxidant supplements, produce beneficial general antioxidant effects, but do not reliably achieve the nerve tissue concentrations needed for the specific mitochondrial repair benefit we are discussing. Look for R-alpha-lipoic acid rather than the standard racemic mixture. Most alpha-lipoic acid supplements contain a 50-50 mixture of the R and S forms of the molecule. The R form is the naturally occurring form, the one produced by the body and the one with superior bioavailability and mitochondrial penetration compared to the S form. R-alpha-lipoic acid supplements are available at Whole Foods, Vitamin Shoppa, and on Amazon under brands including Jarrow Formula's R-alpha-lipoic acid, Doctor's Best Stabilized R-lipoic acid, and Life Extension Super R-lipoic acid. One important practical note: alpha-lipoic acid can lower blood sugar levels, which is one of the reasons it has been extensively studied in diabetes management. For most healthy seniors, this effect is modest and beneficial. But for seniors taking diabetes medication or insulin, alpha-lipoic acid should be introduced under medical supervision with blood sugar monitoring because the combined blood sugar lowering effect of the medication and the supplement may require dose adjustment. Give the protocol 8 weeks of consistent daily use before fully evaluating your sciatica results. Mitochondrial repair is a biological process that takes time. The mitochondrial machinery that has been damaged over months of chronic inflammation does not rebuild in days. Most people taking alpha-lipoic acid for sciatic nerve cellular repair notice the first meaningful shift between weeks 4 and 6, typically described as the burning shooting quality of the pain becoming less sharp, less electric, less easily triggered. This qualitative change in the pain character, before a significant reduction in pain intensity, is the earliest sign that the nerve cells are regaining their normal functional capacity. Track your pain score every morning. Rate it 1 to 10 before any movement. After 8 weeks, compare your average to your baseline. The consistent downward trend, slower than some interventions but deeper and more sustained, is what alpha-lipoic acid produces as cellular repair accumulates over time. The patient from our story has been taking 600 milligrams of our alpha-lipoic acid with dinner every night for 10 months. Pain score consistently 2. The plateau that 18 months of external focused treatment never broke was finally broken by one internal intervention. The cellular repair that the nerve had been waiting for while everything else addressed the outside. In 20 years of practice, the seniors whose sciatica recovers most completely are the ones who address every layer of the condition. The compression layer, the inflammation layer, the muscular layer, and the cellular layer, the internal nerve cell damage that most protocols never reach. Alpha-lipoic acid addresses that cellular layer directly, 600 milligrams. With dinner, every day, starting tomorrow morning, your sciatic nerve finally gets the internal repair it has been waiting for. Now, before you go, drop a comment right now. Tell me your age and your city, and how many months have you been dealing with sciatica? Are you currently taking anything specifically for nerve cell repair? I read every single comment personally. Share this with someone whose sciatica has plateaued despite a comprehensive protocol. Subscribe and turn on notifications, because every week this channel brings you something equally specific and equally powerful. 1 tablet, 600 milligrams, with dinner, every day, starting tomorrow. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Alpha-lipoic acid may lower blood sugar. Those taking diabetes medications or insulin must consult their healthcare provider before starting. Alpha-lipoic acid may interact with thyroid medications. Consult your provider if you take thyroid medication. Always consult your qualified healthcare provider before starting any new supplement. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion advised.